Welcome, Miss Melinda Myers, the extraordinaire clinical psychologist and PhD and lectured at Humboldt for decades and owner of Good Relations, fabulous news story in Eureka, California, if you haven't checked it out. Uh, can you go online and get it through you guys too?
Yeah, you should get goodrelations.com.
Oh, even better. And mom to the whole community, but also for amazing kids.
Also, what? 4 kids.
For amazing
Sure.
kids.
Oh, wait, I have 4 kids. Oh, yeah.
Welcome to the V movement, where we talk about all the V's in our lives.
Okay.
Yeah, because there's a lot of them.
Yeah, that's true.
There's a lot of V's. There's a lot of V's. First, I would love to hear more about how you got to where you got to.
Cool. When I was studying to be a junior high school math teacher, I realized that I was too outspoken and too passionate about access to contraception and accurate health information. And the second a kid needed me to take them to the clinic and I did, I'd get fired. So instead of that, I decided to avoid it preemptively. And when I was figuring out what to change my major to from math, I realized I had the same number of units in psychology and in theater. And of those two, psychology seemed slightly more practical. Plus, I really liked those classes. So I switched my major to psychology. And then initially, I was going to be a school psychologist. And then I reminded myself about the problem that I was going to have if I had been a public school, middle school teacher. And the same thing would have happened. So I decided that I would just do my doctoral prep. So Humboldt State at that time, now Cal Poly Humboldt, has a research and academic master's in psychology program that is a doctoral prep program. And so that's what I did. And that was perfectly fine with me. I taught at Humboldt with my master's for many years. And then when I was about 40, I had a student in my office one day with a problem that I could not solve in my office as the faculty member. It wasn't a big problem. He had a question about sex and he was really upset. He was a beautiful young man. I'll never forget him. He's tall and handsome and sweet. And he had just received a herpes diagnosis and he was suicidal. And that's not unusual for people to have a lot of psychological pain around that kind of news. But I couldn't solve it in my faculty office. And I also had no one to refer him to in the community, literally, that had any expertise in sex at all. So I threw up my hands one day and said, fine. And I searched for a program that would let me get a clinical doctorate, that would let me get a license in California. And I didn't care whether I got a tenure track teaching job because it pays like crap. And I already had my store, which is how I supported my teaching habit for 25 years. I just needed a clinical license. So I got one. So when I was 45 years old, I got my doctorate in clinical psychology. I have a PsyD. So that required year-round school on top of teaching and having my kids, and then passing many exams and 3,000 hours of supervised internship. And lo and behold, poof, I'm a clinical psychologist. So my license is in inactive status. I'm not currently practicing. I don't like online therapy. And during the pandemic, that was my only choice. So I am now officially retired from Cal Poly Humboldt and running my store. And it is the first time in my adult life I have had only one job. And I highly recommend it, Sarah.
You know that I aspire to be you.
Yes, and in the meantime, you're going to do how many jobs at once?
I don't count anymore.
Yeah, don't count. You have more children than I do, too.
No, four is the max.
Yeah, you birthed yours, and I did not birth 2 of mine. I got them as wedding presents. And there is a distinct difference that absolutely relates to the things we'll talk about today.
Yeah. I just love your journey so much because I think, one, it shows that so many things are possible. And I think that whenever we put our minds to it and work extra hard, it's pretty amazing what you can come up with.
I think so too. I'm fortunate that I've never had work that I hated.
Yeah.
And I think it makes a big difference in people's overall well-being. Like, it was a tough decision to retire from teaching because I absolutely loved it. And I miss my students, and I loved that intellectual challenge of it, and I really loved having access to any journal article I wanted to read at the touch of my fingertips.
Hey, I got you. Whatever you need.
Yeah, but I think that I think I earned this place where I am right now, and I take a lot of satisfaction in it and do a lot of sex ed every single day at my store, so that's fun.
Yeah, it's amazing. It's the best. So really, we asked you here today to go over what does when a patient would come in with a mostly you were doing sex related questions. Is that
Yeah.
correct?
As a therapist?
As
Do
a
you mean?
therapist.
Yeah.
Yeah.
I would say that I did a lot of couples therapy and I did a lot of work with individuals, and yeah, almost always there was something to do with sex involved in it. Yeah, I'd say so.
Yeah.
And I worked with people with gender concerns and counseled people through gender transition,
Yeah.
and have supported people in various kinds of coming out processes, but also have helped people with sexual pain concerns, which is where our expertises, among other places, overlap, and helped people with just, it's amazing the things that people don't know about sex. It amazes me.
Okay, so that's a great place to start. Give us what are your quick go-tos that people don't know and should know about sex?
You get to decide. I think one of the biggies has to do with consent. And I would see people, and this is true, my students and I would talk about this. People have sex for lots of reasons. And I do not have the right to tell somebody else the reasons they should and should not have sex. However, I have a firm belief that people get to decide whether they want to have sex for whatever reason they want. Sometimes we are sensation seeking because for many of us, sex feels good. But there's lots of people who have sex and sex doesn't feel good and they still want to have. For example, sometimes people have sex because they want to maintain a relationship harmony and they don't really want to have sex. They don't like sex. They don't like the sex they're having, but they still have the right to decide they want to have sex. Sometimes people exchange sex. Melania Trump is my favorite person who exchanges something for sex to talk about because I think that we, especially those of us in my industry, I sell sex toys for a living, ultimately can get on our high horse about being snobby about people who do work that relates to sex. And I think about sex work very broadly, and I absolutely put Melania Trump in the universe of sex workers. No, she gets to. She has traded a whole lot for a whole lot of money. The particular kind of prostitution in which she engages is legal, but I don't think it's a lot different than the kind that most people think of when they think about that term. Anyway, that's enough.
Oh, that might be my favorite aside. I really enjoyed that.
You didn't tell me I couldn't get political.
Oh, I didn't. I love everything that comes out of your
Yeah,
mouth.
and
Okay.
in fairness, early in
So
her career, Kamala Harris probably also engaged in sex for purposes other than pure sexual desire or sensation seeking. It's not like you could say only these reasons to have sex are good reasons. That's my
and I think that's a good point for everyone to decide that.
exactly. And I think it's dynamite when you decide you want to have sex, you get to have sex and you like the sex you're having. Perfect harmony.
And men, we're talking those two examples were of women, but
Yeah.
men engage in similar activity.
Sure. Sometimes men engage in sex that they don't particularly want in order to fulfill a role or an expectation they think others have of them. And sometimes it's performative in order to demonstrate their heterosexuality, for example. And so there are different kinds of problems that arise there. And sometimes people the kinds of dysfunctions that people experience during sex. And in that case, when I use that phrase in this context, what I mean is this individual thinks something isn't working well for them sexually, that they would like to work better sexually. It's completely subjective on the part of the experiencer.
Yeah.
And so I worked with plenty of people with penises in the in my career as a psychologist, and to some degree also in my career as a lecturer, because I would talk with students about these kinds of concerns a lot.
Yeah. And it comes up in so many different ways,
Mhm.
which is fascinating.
Sure.
Yeah. Yeah. The overactivity for some.
Some people, yeah. And again, that's subjective, right? If it were golf, would we have the same issue with it? The answer is no. Then it isn't problematic sex behavior.
Oh, I love these conversations.
Right. And I had somebody from the counseling center at Cal Poly who wanted to, who was consulting with me, which is something I actually still do, was consulting with me about a student who they were seeing. So this person was working in HSU's health center in the counseling department, seeing this student professionally as a therapist, and said to me that this student was masturbating too much. And I said, "What do you mean by that?" And they were like, when I said, "No, actually, I don't. Help me understand what you mean. What is too much?" And so that's what I'm getting at is we have these funny ideas about it because what the literature says, no joke, I wish I could remember which author it was. It basically says one of the problematic things about working in the field of sexuality is that it's hard to identify our own biases. For example, nobody ever says somebody's masturbating too much if they're masturbating less than the therapist who's doing the treating.
Right.
Pretty much, yeah.
Pretty much. And I think that's also a good kind of point, just jumping ship a little bit, but with the whole masturbation topic, for those people who are not engaging in sex with other people,
Mhm.
you can still engage with sex with yourself.
Yes, yes. It's a very
And
healthy behavior. It is also healthy to choose not to masturbate. I think
are healthy.
there are not that many people, and lots of people who say they don't masturbate actually do. I remember the first question I got asked by one of my children that related to sex was exactly this question. It was like, is it true? I was reading in one of those books that's in the office at home, and it said that masturbation might not be bad for you. Is that true? And I said, yeah, not only is it not bad for you, it's actually good for you in certain ways. And then we talked about the ways that it was good for people, like identifying parts of your body that feel good and then ways to touch them that feel good and the stress relief that's involved in helping people sleep and relieving anxiety and relieving menstrual cramps, like the reasons people might masturbate are diverse.
So diverse and so important too.
Mhm.
I encourage it in so many ways, but mostly getting in touch with your own body
Yeah.
and understanding if you do want to engage in partner contact,
Yeah.
understand what you like and what you want
Mhm.
before you engage in that. It just gives, especially those postpartum moms coming back into the playing field, trying to identify with that. But even after big changes, surgical changes or menopause or all of these different things, I
Yeah.
think it's so important just to understand what's going on.
Mhm. Yeah.
But a lot of people, religious reasons and all sorts of different reasons,
Right.
don't engage, and that's okay too.
Yeah, it's one of the it's probably the only basic need I can think of that if you don't do it, it won't kill you. Like you must eat, you must drink water, but you won't, even though masturbation is a primary need, sexuality is central to who we are as humans. You won't die if you don't masturbate.
Yeah.
But I think one of the things I'll add to that great list that you just gave about good reasons is for people with penises in particular, although this isn't exclusive to them, who maybe are orgasming sooner than they would like to, you can engage in masturbation and practice delaying orgasm or practice orgasm without ejaculation or lots of other things that can expand your sexual repertoire. And so increasing one's sexual skill to put it in your like little cedar chest for later. Want to engage with a partner, like you can actually get better at sex by
Yeah,
having sex with yourself.
definitely. Definitely. And the same thing goes for the opposite, at least for the penis owners with erectile dysfunction,
Yes.
to practice and create blood
Yes.
flow, all of those different things. I have
Yeah.
a big population post prostatectomy or prostate cancer folks, and I talk about it all the time.
Yeah.
So good.
People
Okay,
with
so what else do people not know about sex?
Okay, so besides that, what else do people not know about?
Yeah, that like your go-tos.
One thing people don't know about sex relates to the structure of the clitoris. Like most people don't know that the clitoris is a fairly large structure. Most of it is internal to the body. Only a very small part of it sticks out of the body. And most people don't know that or how that information relates to what they're experiencing when they're engaging in sex with themselves or something. So the reason that information is important, right? Like it's not just information, although you and I can nerd out about sex all day. But the reason it's important is because when you understand where all of those structures of the clitoris are on the inside of your body, you can understand why penetration of either the vagina or the rectum in a variety of ways can feel so darn good. Like you don't know that if you don't understand the way your body's put together. I think another one is that orgasm is a spinal cord reflex. Most people don't know that either. That because it's a spinal cord reflex, it means that absent there be significant nerve damage, people can orgasm. And most people can orgasm multiple times, particularly people with vulvas, but also people with penises, although they may not ejaculate every time. And so that's a whole fun conversation too, is the difference between orgasm and ejaculation in people with penises.
And people with vulvas too.
Yeah. 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 For
Yeah.
sure.
Yeah.
See, what else do people know? They don't know what anatomy is normal. Like they don't know that for some people, the inner labia, the labia minora, are larger, and in some people they're smaller. They don't know that most of the time they're not symmetrical because most heterosexual women have not gotten their faces right up in the vulvas of another woman to be able to see the diversity of what vulvas can look like.
I
And
have this
I
great
think
book.
which one do you have?
I paid way too much money for it. And gosh, what is it called? It actually was published, I think, in the early 90s, but
Yeah,
maybe
I have 4 copies of the book that you're talking about with all the photos.
and it has a shell on the front
Yeah, it has a shell on the front, right? Yeah. What is
that looks like a vulva.
Yeah.
It's
me.
I
Yeah, it's out of print. That's why you had to pay so much for it.
I
But it's
paid
just
so
pictures of
much.
vulvas,
Yeah.
right?
And it's so empowering. And I keep it just in my office where I hand out books all the time. But this one, I'm like, no,
Can't take this one. I had 3 or 4 copies of it always, and I would pass it around my class.
yeah.
Look, this is what it looks like. And it's
In
really
all
good.
different shapes, forms,
Yes.
colors.
Yes. Those are all pretty much young vulvas, though.
I know.
And I wish there were some postmenopausal vulvas in there.
Okay.
They also wish there were some new ones, some surgically created vulvas in there.
Ooh, I really like that.
I know. Maybe it's time for us to redo that.
Need a new book.
And somebody told me there was one of penises too, but I haven't seen it.
I haven't seen that one either.
But penises are outside the body, right? I'm going to go off on a slight tangent.
I love it.
Okay. Men can often identify their arousal because there is a physical indicator that's outside their body that they can look down and put their hands on. It's like right there. And they associate that with arousal, although there are reasons why men get erections when they are not aroused, and also reasons why men who are aroused don't get erections. But people with vulvas are not in tune with their arousal. And people, particularly people with vulvas who've been socialized their whole lives as women, are also taught to separate their awareness from their arousal because nice girls don't get turned on. And to put it grossly. And as a result, you have people who don't understand what those changes in the vulva that happen during arousal feel like because they are ashamed to even tune into it. Like just here as we're sitting, I can tell you, hey, Sarah, don't look at your feet, but tell me if you can feel all 10 of your toes inside your shoe.
Right. Yep.
And so you turn your awareness to a body part. And we have a sensory filter in our brains that does filter out information we don't. Most people do. People with ADD lack this sensory filter, and it's why they get so distracted. But you or I could sit here and we can tune into various sensations. And then when we don't need that information, it's outside of our awareness. No longer feel your feet in your shoes unless I say that. And then all of a sudden you do. And I think that when people are aroused, people with vulvas are aroused, it is difficult to have people be aware of it unless you take your attention the same way you just did about your feet inside your shoes and
Mhm.
focus on your vulva. And so I think that one of the exercises that I'm sure you do with your patients and that I certainly did with clients is literally close your eyes and tune your attention to this beautiful body part and see if you can feel all of the different parts of it just with your imagination.
Yeah.
And this is why when women take medicines that increase vasodilation, increase blood flow, like Viagra or Cialis, they sometimes aren't aware that there actually is a physiological arousal process happening because they're not tuned into what those sensations are.
Mhm.
And it's that addition of expectation that goes along with those medications that would make them effective. And that's why the topical vasodilators typically work better for people with vulvas because you can't put them there without knowing you did it, which
So we
makes your
did.
attention focus, right?
So when we taught a class a couple weeks ago, and we all got to put some of these, it's an over-the-counter vasodilator.
Yeah, sure.
We put it
Just
on our lips.
was Philanthus extract, yeah, from a flower.
So fun.
Yeah, it's really fun. And you can totally feel it. And it's like little lip plumper. I used to have really beautiful full lips, and mine are not as full now that I've aged. But if I put those vasodilators on my lips, it's like all of a sudden I have these beautiful pert lips again.
Oh,
But they're great because they increase blood flow to the vulva
right.
and they have a tingly sensation in addition. So there's your attention.
Boom.
No longer are you thinking about the dishes that need to get done. No longer are you thinking about the person at work who annoyed you today. No longer are you thinking about that you have to remember to get gas in the morning, but you're only thinking about your vulva and your clitoris. And that's a beautiful thing.
Amazing.
Yeah.
Yeah. So yeah, I definitely play with the sensory aspect of it. But I also find that some people they can't even look.
Yeah.
So I often I have a couple patients that tease me. They're like, "Oh gosh, don't give me the mirror." But it's really a homework thing
It
that I have
really
people
is a homework. All of us,
to
all of us,
just understand,
you have to know how those parts work. Exactly.
especially for people with pelvic pain. If you hurt your knee and bumped your knee, you touch it. You'd look at it.
It's a
You'd
great
say, "What's
analogy.
going on?"
Yeah. You would be obsessing about it.
Yes.
Picking up your pants leg and making all your friends look at it.
Right.
Yeah.
And I don't think maybe we should be running to show our friends our vulvas all the time. Maybe. But either way, taking that tactile sensation also,
Yeah.
the playing with the sensory aspects in it. And
What does it feel like when I touch this part this way?
Yep.
Like, right? Different intensities of touch,
Yeah.
different speed of movement, whether or not one is using a lubricant or not. Highly recommend lubricants. Whether the outside of the opening of the vagina feels different than just inside the opening of the vagina. Like really being able to identify those parts. And it's very difficult to do if you're not looking at it.
And then temperature too.
Oh, yeah. Yeah. Good idea. For sure.
Right. Yeah. Just to see what sensory feedback you are
Sure.
getting
I agree.
and to play with it.
Yeah. We have right now, there's one of the sex toys and innovation in sex toys is really fun to understand. But one of the things that's happening now is there's a whole bunch of sex toys that warm up to just above body temperature. They warm up to about 104 degrees. And that sensation, especially for someone who's experiencing pain, is really great. So somebody who has, say, pain from endometriosis or deep pelvic pain or pain with menses, it's like a hot water bottle inside your vagina, and it's
Yeah.
just so soothing, and I'm delighted that's one of the things that's happening. And then there's one toy that switches back and forth between heat and cold, and it's not cold enough to harm you. It's just cold. It's definitely cold to the touch, and you can play with the kinds of sensations that you just talked about, both externally and internally on whomever's body parts wants to play with it. And I think it's just so cool to understand, like, oh, do I like this? And do I like this on a Tuesday? And do I still like it on Thursday? Because it's not the same.
Oh, it's so true. Or hour to hour. You never know.
Yeah. Yeah.
Yeah. Yeah.
But I guess
So
that's also in the category of things people don't know about sex, is that it's not always the same. And things that you liked today or the sensations that you enjoyed in that particular context, you might not enjoy if you tried them again. Or
and oh,
yeah, exactly. And you can stop doing anything that doesn't feel good. You do not have to keep doing it.
and that can be really empowering for people.
Mhm. Yeah, it does.
Yeah.
People's yes takes on a lot more meaning when they have a nice no.
Yeah. That is an amazing quote. We got to hold on to that one.
Thank you very much. We don't socialize women to be able to say no to most things.
Yeah.
And like, because we're afraid of hurting, we're socialized that we must be nice at all costs. We must not hurt someone else's feelings. We must not be rude. Like, there's a whole lot of stuff that's written in. And this, second aside, this is not universal across the female gender role across cultures, but it is in the United States among white women, particularly, that we are socialized in these particular ways. And so it makes it very difficult to say no. We will say yes in a really non-convincing way when what we really mean is no. And this is not cool. Like, I think that for there to be consent with sex, it should sound like, hell yes, absolutely. Let's do this now. Let's do this in 10 minutes. Let's do it tomorrow. But like, enthusiastic yeses are not the same thing as, "Oh, yeah, sure." That isn't a yes. And until we teach women the power of no, their yeses just don't have as much power.
Ah, I love it. I love There was a couple of things. So what about desire?
Complicated beast desire.
Yeah.
Yeah.
Aren't we complicated?
Yeah. Which is fun.
Yeah.
But you probably, like I did, have a lot of people in your office who don't experience sexual desire at all. Yeah.
Oh, yeah.
Yeah. And some of them actually are fine with that, but their partners aren't. And that is a very difficult situation to treat. And some of them genuinely wish that it would come back for themselves.
Yeah.
Very different animal. And one of the things we have
Wish
to
they
do,
had it at all.
and one of the things we have to do is understand what are we dealing with here? Desire, the book Come As You Are, and we've talked about this book before. Emily Nagot's book is great. So it's built on premise that was done by the research from Rosemary Besson, but it's really about the kinds of things that increase desire and the kinds of things that dampen it. And understanding what those are and feeding the things that are your accelerators and understanding what the brakes are, and then learning how to communicate them with your partners. Um, and it, like everything else we've talked about, it changes with time and it changes with circumstance. It's really elusive.
Yeah, it really is. And I think that it also changes depending on what decade you're in life.
Yeah, sure. So I
Yeah.
think that sometimes when we have small children, it's hard to access desire for some people who have small children because their bodies don't feel sexual as much as they feel functional. And women describe, and people postpartum generally describe, like their bodies being pulled on or touched in ways that don't feel sexual. always having a toddler, having a hold of your boob, for example, is even though physically the same nerve endings might be firing, your brain is doing something very different with these pieces of information. And so we have lots of inhibitory nerve junctions in our brain telling us that isn't sexual. And there are lots of good reasons for that. I'm not saying there shouldn't be, but it's very hard to turn that off and then turn off the inhibition and access the part of your brain that says, no, actually, this feels really good, and I want to experience more sexual sensation. This is brain training,
Mhm.
and it's hard. It's really hard work because most people think without meta analyzing their thinking, right? Like most people have completely untrained hamster brains,
Yeah.
a whole bunch of hamsters running amok in their brains with absolutely zero control over it. And so it's hard to train your brain to focus on the things you want. And our brains are pre programmed to avoid pain and death and disaster. So it's hard to train your brain to focus on things that are pleasant and enjoyable. There's a phrase in Buddha's brain that says our brains are naturally Velcro for bad stuff and Teflon for good stuff. And the techniques of mindfulness are designed to help us be able to choose the things we want to focus
Yeah. I
on.
like that. And that reaches all decades of life. I just had a patient the
Yes.
other day, postpartum, just really having trouble accessing desire.
Yeah.
No, not postpartum. Sorry, postmenopausal,
Postmenopausal.
menopausal,
Yeah.
because of all of the different things.
Yeah.
There's so many things.
Many
But I
things.
like that of
Yeah.
trying to figure out how to access
So
without having a
I'm gonna
hamster.
say something hard to hear for a lot of people, but is true from my clinical practice. I could tell you that most of the people I saw who had those kinds of big dips in desire postmenopausally had relational difficulties they had been ignoring for decades. And they had found ways to ignore that and access desire anyway. And with the biological and other changes that come with menopause, there comes this interesting psychological switch where you stop putting up with people's shit as you age. And I don't think we talk about this. And that intersection of standing up for yourself, being done with other people's expectations, and a relationship that may have some significant issues is the reason that 95% of the people I saw who were postmenopausal with desire difficulties ultimately figured out what was going on. It's hard. It's really hard. Because then what they really wanted to do was access desire and not solve. And that's a hard thing to do postmenopausally.
Yeah. Yeah. It takes being vulnerable, and that's scary.
Yeah. It takes a lot of vulnerability.
Yeah.
Yeah. And
Yeah.
I think that you can find ways to muscle through it. I think about it like if you're in the gym and using bad form, and you can do this thing using bad form until imagining something that requires you to brace your abs, right? And you can keep doing this thing without bracing your abs only for so long before you hurt your back. And once you hurt your back, you're like, okay, can't do that anymore.
Right.
I think it's similar.
Yeah. Yeah. And that's when they come and see us.
Uh-huh. Yeah. And we're like, so let's talk about the ab bracing. And they say, no, my back hurts. We say, let's talk about the ab bracing.
Yeah. Let's go back. Let's go back. Oh, it's so true. Oh, I love that. That's a great analogy. That's perfect. That's perfect. All right. I feel like we've done a lot, but what one last like full tip. What do people not think about sex that they should know, that we should be talking about?
I would say that all bodies are good bodies and that they're deserving of sexual pleasure
Ah,
exactly like they are. So
yeah.
that's from, I have several friends who own stores like mine, but that came from my friend whose store is in Albuquerque, New Mexico. her store is called Self-Serve Toys, which I think is the cutest name for a sex store. And she made stickers that said that. And I find that really powerful, that you don't have to lose weight before you deserve to have sexual pleasure. You
Right.
do not have to have all of the body parts that you might have come with when you were born. They might not, they don't all have to work correctly or whatever that means. Like you don't have to look a certain way, you don't have to be a certain way. All bodies are good bodies and they're deserving of sexual pleasure and love. And you can access it in a variety of ways. So even if someone is quadriplegic or paraplegic or has cerebral palsy or Down
Or
syndrome
MS or
or
Parkinson's.
whatever, they're still deserving of sexual pleasure, although they might need some help from people who know how to do this.
Right.
Because training people with disabilities in order to access adaptive sexual pleasure is definitely a specialty that has a huge need for practitioners. There's just not enough people doing it. So I would say
Ah,
that's the big one.
I love that. I love, and I bet you get a bunch of that in your store.
Mhm. I do.
Yeah.
But we hear it. Like, I definitely hear people who say, I'll be back when I lose weight, or
Yeah. Oh, I could only fit
this
into
isn't
that.
for me. This isn't for me because I'm older. This isn't for me because I've had breast cancer. This isn't for me because I've had prostate cancer. Look, there are so many ways of making bodies feel good and enjoying the sensations of touch of ourselves or of someone else. And there are definitely ways of accessing that, lots of them. But
Yeah.
it's like giving people permission, right, to enjoy the sensations of their bodies however they choose. You're not hurting yourself, harming yourself or someone else. Have fun.
And that's maybe a whole topic for another conversation is the whole hurt versus harm.
Oh, yeah. Yeah. We can definitely talk about that.
That's a whole, that's a deep rabbit hole.
Mhm. And people who use intense sensation in order to help them access all kinds of things, ecstatic things, therapeutic things. There's actually a great deal of literature about this now, which I think is super cool.
Yeah. We, in the sex coaching class, we talked a lot about, and I just always laugh because what was that book that came out that everyone jumped on?
How long ago? 50 Shades of Grey.
Yes. That it was just like people were like, oh, now we're able to talk about these things.
Yeah. We need to talk about how bad that book is because it's abuse, not consensual kink play. There's the lesson. It's like,
At all.
right. There's lots of healthy, wonderful kink practice that people engage in that could look a lot more intense than anything that's been portrayed. It
Exactly.
be like that. But you get to do what you want. And to do so safely, I think is really important.
So important. And then it circles all the way back to that consent thing you first
Mhm.
brought up.
It does. Full and enthusiastic consent. And so when somebody's engaging in kinky stuff, they use a contract. They sit down outside of scene, fully clothed, and go over wants, desires, limits, safe words, length of the scene, like all kinds of things in order to make sure that everybody is giving free consent and that people are exploring what they want to explore as deeply as possible within the bounds that they understand. And we all are such subjective beings that getting something like that to be explicit, I think is really important. I also think it's important in vanilla sex, and we don't do that either. So
Totally.
I said to give a lecture when I was teaching human sexuality about what vanilla people or players can learn from kinky players. And one of them is how to negotiate the kind of sex that you do and don't want.
Oh,
Like, yeah,
it's the communication aspect of it.
yeah, it is.
Yeah. And it doesn't always have to be a written contract.
No, and you can it doesn't have to be. I think that when you're playing extreme stuff in kink, it's probably in most people's legal interest to have it in writing, but it doesn't have to be. And I think when you're playing sexually with another person, talking about sex, it's like such a strange concept that you can have sex with people, but talking about it is more intimate, and that's harder.
And I think that's not just like cake versus vanilla. I think that's everyone.
It's everything, right? It's just sex in general.
It's sex
People
in general.
do not talk about sex.
No.
People have some pretty wild sex without ever discussing it,
Right.
right? Hope that works out for you.
Yeah.
So couple take-homes are that at Good Relations, we always have Plan B. We sell it for $14.99. I also always have it for free if anybody needs it and doesn't have $14.99. Lots of other people in our community have bought 2 and stashed 1 for whomever in our community might need it. So we're open, says it 7 days a week. And I think that's an important thing. And most of the independent sex stores that I know of now are all carrying Plan B. So we're open on the weekends, and that's a good thing to know, right?
I'm so proud of you. That's amazing.
Thanks. Yeah, it was actually really easy to do. It is an unrestricted, it's just like buying Tylenol, right? So we don't need any special license to do it.
Yeah.
You cannot age restrict it. Federally,
Mhm.
it's protected so that it is accessible to anybody of any age and any gender. Yeah. So we have that. And I think people should know that we have it.
Yeah. Everyone should know about that.
Yeah.
What else about your store do we need to know?
That it is in Old Town Eureka, the corner of 2nd and E, in this really pretty brand new building. We moved a year ago, a block up the street closer to town. And if you haven't seen our new store, you should come by. We're also available at goodrelations.com, as you pointed out. And we have an Ask the Sex Experts contact form on our website. So if somebody's coming up with a question or they're not sure who to ask, you can always ask us there. People have asked us for resources there. They've also asked us some sort of technical things about sex, and we're happy to answer those. Most of the time, I'm going to answer those personally, although sometimes the people who work for me will answer them depending on what they are.
That is so cool. And anyone can just go to your website and ask
Yeah.
any
And
questions that they want to have.
you don't have to put like your name and social security number there. Like it's whatever email is, make up an email just for that purpose if you want. Like,
Yeah. Yeah. Oh, that is amazing. How cool. What a great resource for the community.
thanks. That's what we're hoping.
Yeah.
Well,
Yeah. That's empowering. Oh, I feel like I could talk to you forever. But I do also want to tell everyone that you and I and Carrie are hosting another class at your amazing store.
Dr. Carrie Griffin, 3 docs who talk sex returns. They talk pleasure.
Maybe that's what our thing should be. 3 docs who talk sex. I really think it's great. And that's going to be on Wednesday, September 4th at 6:30.
6:30.
At your store. We normally charge, what do we say, 25
Or
cents?
$25 at the
30?
door, I think is what you did, or $30
Yeah.
or something like that.
And just come and hang out and play.
Yep. Yep.
We
We
are-
start on time and we end on time to get you home to your little ones. And
And all of the things that life has. But the awesome part is that Melinda allows us to cruise the store.
Yeah,
You
that's
can
true.
see all of the cool products and
Yeah.
ask questions directly to her at
Yeah.
the store and to, of course, Carrie and I.
Yeah. And I think we're going to talk about this time some of those and how they work. So integrating the things that the 3 of us do.
Yeah.
Maybe we could talk about the pelvic wands. That would be cool.
Oh, yeah. And Carrie has been she dives into all of it, but the actual different parts in the female anatomy that can really help to trigger
Nice.
fun.
Oh, that'd be awesome. Let's talk. And I look forward to it. Sarah, thanks so much for inviting me. It's been really fun.
Yeah. And thank you. You are the best. I can't wait to see you soon and see everyone else.
I know, right? Well,
Yeah.
soon.
Right.
Thank you for listening, and we highly encourage you to check out goodrelations.com for all of your pleasure needs. All of the people who work there are super helpful and sex positive. No question is embarrassing, and they are there to provide a positive experience. A link will also be provided in the show notes. Until next time, keep the V's in your life moving. The information shared in this podcast by Sarah, Allison, and our guest interviews are intended for educational, entertainment, and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. While we are licensed physical therapists, we are not your personal physical therapists, and no patient-provider relationship is formed. If you have any health concerns or questions, please consult your medical provider. The information on this podcast or any of our other platforms is to use at your own risk.